so tell me what's happened to your back.
I think through bad posture sitting at my computer, it's gone into muscle spasm. The reason why I know what that feels like is because having one leg shorter than the other, when I was younger, before I knew that I had to have my shoes adjusted, I constantly went into muscle spasm, so I know what it feels like. It's not just like I've injured my back, I know it's specifically the muscles are just in spasm.
Can you rate your pain from 0 to 10 at worst? How much?
I'd say I'm about a 6.
6. What kind of pain? Is it sharp, dull, aching?
It's a dull ache until I move in certain positions, or if I've sat for too long and I go to get up, it's about an 8. Then
you feel your back locking on you when you
it's
stand
just
up?
really tight around the hips.
Any sharp pain going down to your legs?
No,
or just localized
no,
in the back?
it's just in the back and a little bit from here, just from leaning my head forward, I'm sure, at the computer. But I put everything up on books because I'm like, okay, I've got to get through this work. So.
We'll work on that. So can you do the motion that aggravate your symptoms and stop when you feel pain? So bending forward, aggravated, it will stand up nice and tall.
So about here, it's starting to hurt.
How much?
About a 6. It's not, it's not dull. It's like a bit of a twinge.
Go backward.
Lean backwards.
Lean backwards.
Oh yeah, that's not good.
Okay, you're not even going. Twist to the right.
I can do that, but
Left.
It's a bit tight. Because I went to yoga. Left's fine, not as bad as right.
Side bend to left and right.
This way? Okay. Yeah, it's still tight.
So the worst motions are forward and backward.
Yeah, and getting up.
Getting up, sit to stand.
Or to lie. Like when I went to yoga, I went to yin yoga just to kind of stretch my body out a little bit, and it's very soft poses. So I noticed anything where I had to get up off the ground into a forward position, or to stand up, or to kneel was difficult and painful.
All right. So what I want you actually to sit on the table over there.
Yes.
And I'm gonna do like a couple of things, and we're gonna test it afterwards. Is it okay to pull this up?
Oh yeah.
Okay, interesting. All right. So make sure you let me know if you feel any pain, okay?
It's just cold.
Yeah, I'm working on that. Feel the tightness here? It's a really very tight fascia. It is the area where you have the spasm. Okay.
Yeah, and through here. I mean, like it's just here today, but like yesterday was my entire back. Like I couldn't move.
Your whole back.
Yeah, I was like an 85-year-old woman.
And you said you were like it was too painful that you had to lie on the floor.
Yeah, I lay on the floor and I was doing ice, and then for about 20 minutes, and then I would put a hot water bottle there for about 20 minutes, and it just alternate. And it really helped bring the inflammation down.
Okay. And how often you have this issue?
Lately, it's kind of been flaring up every couple of months.
Every couple of months.
Yeah.
So this episode been for 2 days, you said?
Yeah, it started yesterday, but today it's released somewhat.
So I'm just doing some release in the back. And I want you to stand up and bend forward and tell me how much from 0 to 10.
Okay. We're down to about a 4.
Yeah, you're going further.
Yeah.
Beautiful.
I mean, I could go down further, but I'm just trying to be
I
gentle.
don't want you to aggravate it.
Yeah.
Let's go backward and see, because backward you could not do that.
Yeah, it's tight, so I'd say it's about a 4.
4?
So, yeah.
Where do you feel it exactly?
It's right in here.
Okay. All right, have a seat. Okay. That's too much, okay.
No, that's totally fine.
How you describe what I'm doing now? How it feel on your skin?
It feels like you have a piece of rubber.
Okay. That's true. It's a
And
rubber.
you're
Okay.
you're stretching it across my skin. I mean, it's not painful or uncomfortable, but I have to admit, it's not the nicest touch in the world.
All right. It's not massage.
No, it's not massage. It kind of feels like sometimes when skin is
rubbing against
Yeah,
each
and
other.
and it has no lubricant or it's dry or something and it sort of sticks.
Yep, that's the goal of this to work. Alright, let's try it again.
Okay.
Forward.
Still, yeah, it's about a 3.
And you're going further. Are you normally touch the floor?
Oh yeah. Well, I've got heels on right now, but
Okay.
I could normally flat, flat hands.
Your norm is okay. So our goal to get you to your norm.
Okay.
All right. So where do you feel it when you did that?
Same place.
The same place.
Yeah.
Let me see how you like go backward and see how you're doing that.
Backward, it's about the same as before.
Okay.
The same place. It's right in here.
Right in there. Okay.
Yeah. It's.
So let's actually sit again.
Same deal.
Yep. We're
Okay.
gonna do. We're gonna release the whole.
Sorry, my back's being very difficult.
No.
Probably knows it's on camera.
You're actually doing good.
Oh, okay.
I did not have a lot of range of motion when you came. Actually doing very well. You have a lot of tightness in the back.
I know.
You feel that?
Yeah. Oh, I have a fantastic massage therapist, and she's free tonight. So I'll be doing that before I go to bed.
Okay. And you said the upper here, this area too, yeah?
Yeah. Sort of here, where the
In the middle, between your shoulder blades.
yeah, sort of where my neck joins into my shoulders.
Okay, so let's take your shoes off, and I want you to bend forward and see if you can go down.
Okay. Oh, hamstrings are a bit sore, but yeah, I mean I can feel it in my back here, but I can get down.
Where do you feel it?
Same place.
Okay, okay, let's come back. How much from
I
0
don't
to
want
10?
to. What?
How much from 0 to 10?
It's still about a 3.
Okay, alright, so let's actually lie on your back. Head over there.
Head that way, on my back. Okay.
Okay.
Ah.
Okay, we'll get your pillow. Okay, scoot up this way.
Scooch up.
Okay, let me know if you feel any tenderness with light touch, okay?
Are you gonna do anything?
Okay. Let's not do that, okay?
Sorry.
Okay.
Now I'm on to you.
Alright, can I touch your knees?
Yes.
Okay. Last time. Painful or is it okay?
It was a little painful, but that's the knee that I smashed into the concrete like 3 weeks ago. So.
Did you tell me that?
Yeah,
Oh, okay.
I slipped. I was in a lunge and I slipped and I wasn't in a lunge. So I ended up in a lunge because I slipped on wet, moist tile, and that knee was the one that hit the. Ooh la la.
Sorry.
No, that's okay. It's gonna take a
As long as you don't kick me, that's fine.
No,
okay?
no, I won't kick you, but I might laugh.
Okay.
Ah.
Okay, lift your head up. Relax.
That's exactly where it hurts.
Push my hand down.
With my back.
Yep, and relax. Let go. Okay.
Yeah, you got right on the money there as far as the muscles in my back.
You got a lot of muscle spasm there.
Yeah.
Okay, push it down. And relax. Let go. Make sure you breathe, okay? Stand up and tell me how that feels. Bending forward.
Oh yeah. Yeah, we're getting better.
Yeah, and backward.
It's just.
You feel it when you go backward?
Yeah.
Okay.
It's right where you had your fingers. It's just where it hurts.
Is it okay to do scar tissue release with the lotion in the back?
Sure.
Yeah, okay. So are you comfortable? I will have you lie actually on your side facing the camera.
Facing the camera, yes. I'm shy and demure. Surely he's going to edit this part out.
Okay, so we'll have here. Right.
I'll just have a little nap.
Yep, you can do that. And
I don't know if I can do that with cold equipment and.
yeah, it's gonna get warm from your skin, okay?
Mm.
Bend your knees. Relax. This gonna feel really cold, okay? Alright, so.
I'm excited. No.
You're excited?
Mm.
Did we do this before?
Yeah.
Okay.
But I don't know if we did. We didn't do it on my lower back. I think we did it between my shoulders.
Shoulders. Okay, so it's gonna feel a little bit cold. Okay, I can see your muscle here.
Oh.
Sorry. Okay.
It's okay.
Yeah. And
Oh wow. Okay.
Okay. It's not.
Do you keep those things in the freezer? Like seriously, come on.
No, not. But it's just.
Ooh.
It's a little bit cold. That's
Yeah,
okay.
it's a little bit lot. A
Is
little
it-
bit lot. Yeah.
Is
not
it
cold.
painful?
No, it's not painful.
Okay. It's just cold.
It's
yeah.
just tight. My muscles are tight, but it's not painful. I'm used to it. You know, this has been going on for years.
Yeah, I can see the scoliosis here actually. So it's this area.
Mm.
Any pain?
Just feels good.
Okay. So how you describe this tool? Like when I'm breaking the scar tissue, how that feel?
It kind of feels like a giant finger.
Okay, it's a giant, but it's
Like it's like you know, it's firm.
Mm-hmm.
It's firm, but it's not like firm like something sharp edged. You know what I'm saying? That's why it's sort of the way I would describe it is kind of like because it's firm, but it's not.
It's gentle. It's not.
Yeah, it's gentle. That's why I describe it as like a large finger
Okay.
because it's one piece. You know what I mean?
Yeah.
Not versus a fist because a fist it has bumps on it. This doesn't have bumps on it because it's smooth. So that's the only way.
Mm-hmm. So this is actually the patent ASTR tools. That's what I use to release the scar tissue.
Yeah, it's definitely smooth.
You can see a big knot here.
Oh, it's
Can you feel
huge.
that?
Yes, I
Yeah.
can.
Okay. I'm gonna give you exercises after this.
Okay.
to show you
And I'm
how.
supposed to do them every day?
Yep.
Okay.
It's a good exercise. You will like it actually.
Okay.
It feels better than the stretches. So I will show you those. How you do it. Okay, so we can clean this up. Sorry, get some motion on
Yeah, okay. Last time you got it all through my hair, so you know. you just-
No, not today. Okay, when
Okay.
you're ready, you can
Cool.
stand up and tell me how you feel.
Oh yeah, I can definitely feel that it's been released. Some
more and tell me how is that.
I'm stuck. Oh.
There you go.
Oh, thank you very much. Cheers.
How's that?
Yeah, it's definitely good going backwards, but it's still a little bit tight in that lower.
How much from 0 to 10?
This is
Fifteen.
good. This
Oh,
is
look at that.
Oh, this is really good. I don't.
Wow. That's really good.
Yeah, that's down is good. Back's not as good.
How much from 0 to 10 when you go back?
I'd say about a 2.
And where
It's
you feel it in the same?
It's right in in here when I go back where I feel it, the tightness around
Okay.
where my I guess my muscles join my hips. I don't know. I'm not a
Okay.
doctor.
Just tight. It's not painful.
No, yeah, it's tight,
You feel tightness there.
but I wouldn't say that it's a searing pain.
Is it okay to work on this? I'm not like over your shirt.
Oh,
on the,
sure.
on the-
Yeah, I'm good.
Alright, so it's lying in your back.
Oh. Oh.
Right. Okay. So Are you ticklish?
Yeah, we went through this I think last time.
Sorry.
But that's okay.
So I can.
What's the name of that muscle?
Which one?
The one that comes down and joins to the back through the front.
There's one in the head, the LUSOS, and
That's
there's the rectus.
That's the how do you say it?
LUSOS. Because you try to go backward and you feel it a lot. Just want to make sure your muscle relaxed. And
Oh.
sorry.
That's okay.
It's okay.
I'll try not to laugh.
At least it's fun.
Yeah.
PT is fun.
Oh yeah.
Well, ASTR is fun.
Yeah.
Okay.
I'm having a blast.
Alright. Okay. So, let me know if you feel any discomfort there.
No.
Okay, let's stand up. Try it again.
We go back.
Yep. How's that?
It's about the same. I'm being honest. It's just right, and it might just be residual.
It's a tightness, not pain, yeah?
Yeah.
Okay.
Yeah, and it's
Mm-hmm.
yeah, about the same tight.
Tight right in the back there.
Yeah, but it's not pain like it was
Mm-hmm.
this morning.
So let's have a seat here, facing you. Relax.
Oh.
Let's go. It's right in here, yeah.
Lower.
Over here.
Yeah, it's in like here.
Okay.
No pain, just.
As I told you, everything should be pain-free, so make sure you let me know, okay?
I will. No, I won't slap you.
Well, if it's an inflammation, I will do something else for inflammation, so I want to see how you're doing after this. And check if you have inflammation from muscle spasms. Let's bend forward and backward and tell me how you feel.
Okay, backwards.
Mm-hmm.
Oh, that's better.
Mm-hmm.
Forwards. Yeah.
Mm-hmm.
I think it might just be inflammation.
Inflammation,
Yeah.
okay. But your range of motion much better.
It's much better. Yes,
Yeah,
it is, and
your
it's not.
range of motion, turn left and right, and tell me if there's any tightness.
There's tightness on this side, but I usually have stuff going on that
Okay.
side. That
How
side
much
looks-
tightness from 0 to 10?
Well, I don't know. I mean, am I
Can
supposed to be
it's-
able to turn my head all the way around?
Not like an owl, but you
Yeah,
can
but-
turn like at least 85 to
So I've
90
got it-
degrees. Yeah,
So it's tight from,
Okay.
and I feel it from here up to here.
up to there. How much tightness from 0 to 10? 10 is a
Well,
really-
I'd say a 2 or a 3.
Let's do that.
I mean, I can get there. I just feel it, and this is fine. There's no,
You have more limitation on this side than the other side.
but
You're not.
but I
turning
don't
this
feel
way. You
pain.
don't feel it. Okay, backward. That's not bad. You're hypermob to begin with.
Yeah,
Okay.
I'm just hyper in general. I think.
Okay. So, and you said you had trauma here.
Yeah, I was hit by a car when I was 11, and so I have a large dent
Mm-hmm.
and a scar running down the side of my head that people say that explains a lot.
But no one broke the scar tissue.
No, I've never.
No
Oh
one
no,
worked on those.
no,
Okay.
no. That scar tissue's probably
Okay.
quite solid, I'd say.
Yes. So, do you get headaches?
No.
Okay, you don't have headache today.
Sometimes, the only time I get sort of like a headache, and it's always affected by this. If this gets irritated,
Mm-hmm.
then I can get a headache, but and I'll release it through here and here. But or if my sinuses are blocked, I'll get a headache. But I don't get headaches.
Okay.
Mm.
Alright, so let's lie on your back.
Okay.
Okay.
I'm glad I did my hair for this video.
Yeah, thank you. Yeah. Let's go toward me.
Okay.
Alright. Okay. So everything should be pain-free, okay?
Okay.
So
But we're dealing
I
with a
can,
scar that's,
I can feel this bump. Is this what you're talking about?
yeah,
Okay.
there's a dent.
Yep, I feel that. Okay. Do you have more than that? Is it like that big or
Should
like
I need more? Or?
bigger than that?
No, that's it. That's the big bad one on my head.
Okay, so I'm gonna work on it to break it gently, okay?
Good.
Make
I don't want
sure-
you hammering my head, not gently.
No, not today, okay? Not in the front of the camera.
Yeah, that's afterwards.
Yeah.
Did I sign that waiver? I don't know if I did.
Yeah, we're gonna do that before you leave.
Okay.
How does that feel?
That's good. It
Okay.
feels like you're scratching my head. It's quite nice, actually.
That's, yeah, if you, well, that's not my goal, but yeah. The goal is actually to break the scar tissue, so
Uh-huh.
it feels like scratching, but it's really working on the scar tissue. Make sure you let me know if you feel anything, okay?
Oh, well.
You had stitches there?
Yeah, I think I had like 17.
17, so that's a big one.
Yeah.
Yeah. And your skull cracked or?
I guess so, because that's how it dented. But I never saw the x-rays, put it that way, so
And you have chronic neck pain, yeah?
sometimes I get chronic neck, and I put it down to the computer, but if you think that there could be a,
We're gonna go over what to do to avoid these issues in the future, you know, like what proper like posture, body mechanics, the things that usually cause flare up for neck and back issue. To make sure that you don't have these issues in the future. Any discomfort with that?
no,
Okay. Okay, let's sit and I want you to turn your head.
oh,
Do you feel lightheaded?
yes, I feel lightheaded. I felt lightheaded while I was lying down, actually.
Okay.
So,
Get you some water.
oh.
When I break a scar
That's
tissue.
interesting, it's not tight. Yes, I think you did.
Yeah.
It's not as tight on the side.
Yeah. When I break the scar tissue, that's break toxins and waste products, so we want to flush it quickly after the treatment. That's why you feel lightheaded.
Right.
It's like massage.
Mm-hmm.
So you want to flush it so you don't feel soreness. So let's turn left and right and tell me how that feel. Let's look further. Okay, that's good.
Yeah,
Okay.
it's not as tight as it was before.
You still feel some tightness, or it's totally gone?
No, it's gone. I
Back.
mean, other than the fact that my head's stopping because I think that's as far as it goes.
Yeah,
but
I think that's a good thing. It stops.
yeah.
Yeah.
Mm. Yeah. No.
Good. Awesome. Thank you so much.
Thank you. Cheers.
Actually, I want you to bend forward and
Oh.
see if that made a change to your back.
Oh, let's see. Yeah.
Yeah.
Okay. Oh yeah, it's not as tight as it was before.
Yeah.
How strange.
Well, the whole body's connected. It's one piece. It's not
Thank
separate.
God, otherwise
Go
I'd be
backwards.
dismembered walking around.
Go backwards. How does it feel?
It's much better.
You still feel tightness or not?
A little bit, but it's a smidge.